For teachers involved in the care of traumatized children and their families, the essential act of listening to a trauma story may take an emotional toll that compromises professional functioning and diminishes quality of life. Individual awareness is key. Individual awareness of the impact of this indirect trauma exposure, referred to as secondary traumatic stress, is a basic part of protecting the health of educators and ensuring that children consistently receive the best possible education from those who are committed to teaching them. Secondary traumatic stress and burnout have some factors in common, but they also have factors that are not the same. Common factors include high student numbers, a personal history of trauma, limited access to consultation, lack of a supportive work environment, and/or a supportive social network. They differ in this way. Burnout is often due to long-term involvement in an unsupportive work environment with large workloads and large amounts of paperwork. With burnout, increased workload and institutional stress, rather than the result of exposure to clients' trauma, are the precipitating factors. Any professional who works directly with traumatized children and is in a position to hear the recounting of traumatic experiences is at risk of secondary traumatic stress. That being said, risk appears to be greater among women and among individuals who are highly empathetic by nature or have unresolved personal trauma. To help mitigate the impact of secondary traumatic stress for staff, it is critical to be aware and to have a plan that supports positive coping strategies.